For 3 years, I've been dealing with dizziness. And so we thought something's going
And
on.
pressure.
And pressure, like migraine. So the issue's here, my ear, my neck, and under my armpit. And so the tightness, I thought I was having a stroke.
Yeah.
So they said, no, the brain, the heart, everything's good. They said, you need a neurologist.
Yeah, for sure. Yes.
So they said, you need a neurologist. There's something going on here.
Uh-huh.
It shoots out to here.
But he did all the tests. He did brain tests. He did
Everything.
everything.
Oh, wow.
Everything is good.
Nothing.
Well, they found 30 blockage and 70 blockage.
Narrowing.
Narrowing. But it's good. It's not causing the dizziness.
Okay.
It's whatever is pinched or whatever here that's done. Whoa, I'm off balance. That's what
Oh,
they
wow.
want to say.
3, 4, 3, 3, 3. Oh, I feel it behind my ear, right there. Oh,
So, okay, I'm check here.
3, 3.
The neck is okay, right?
Yeah, 3. That's good. That's good. When you did it here,
Uh-huh.
I felt it on my ear.
Oh, wow. Okay, how about this spot? 4, 5?
3.
3.
I feel a needle.
It felt good. Like,
You feel good?
like right,
Uh-huh.
right here,
Uh-huh.
the nerve just like it released.
It
It's like,
released.
I just
Oh, you feel
just feel the relief pressure.
oh, relief pressure?
But
Oh.
all weekend,
Uh-huh.
it's here and then here.
Oh, okay.
Oh shoot, I raised my arm. Yeah.
So before you cannot raise your arm, when now you can raise your, you
It
hurt.
hurt here, and I do that, it hurts.
Uh-huh.
Now it doesn't hurt.
Now does it hurt? Oh, okay,
So
good,
I
good.
just realized I went like that, like, oh.
Oh,
So it will hurt there. It doesn't hurt now.
okay.
It's tight.
It's like,
It's right there too. But yeah, feels
much better, right?
yeah.
Oh, nice, nice, nice.
Yeah.
Okay.
Thank you.